The emergence of a new killer virus has sent the world into crisis mode. At the epicentre of the crisis is Wuhan in China.
Reconsider your need to travel to Wuhan.
Doctors reported a new type of pneumonia that causes a fever, coughing, and difficulty breathing in people who had spent time at a seafood and wildlife market. Almost 20 years ago, a similar virus emerged from a wildlife market in southern China. The severe acute respiratory syndrome, or SARS, became an epidemic that killed more than 800 people in 32 countries. But as we know, respiratory diseases can have far deadlier consequences. 50 million people were killed by the Spanish flu at the turn of the 20th century, when 1 in 50 people with the disease died. The new coronavirus has the same death rate. So is history repeating itself? There are many known types of coronaviruses.
And most people are going to be familiar with them from causing the common cold. That's a coronavirus.
Others found in bats, camels, and other animals have evolved into more severe illnesses. Many coronaviruses can spread through coughing or sneezing, or by touching an infected person. Initially, authorities in China said there was no evidence of human-to-human transmission in the present outbreak. But an expert panel concluded there have been at least a few cases of people catching it from others, sparking fears it could spread more widely than the hundreds already infected.
And we've seen cases in healthcare workers who have not been with any animal contact, so we know the healthcare workers are getting it from taking care of patients.
With the Lunar New Year celebrations approaching and millions planning to travel across the country, China is at the most critical stage of prevention. The Chinese government has now placed the city of Wuhan in lockdown, which means at the moment there's no transport out of that city. One of the last planes out of Wuhan has already touched down in Sydney, with all passengers on board already going through biosecurity screenings.